My name's Tara Gianfagna. I'm the registered nurse and I work with Dr. Kevin Tehrani. I'm also the OR director here. I'm going to show you a little tour, give you a little tour of what happens the day of surgery for a patient. So first I come out here, and most of our surgeries are held in the morning. So I usually greet the patient, and they're usually with their loved ones. So I would greet them and then take them with me to our prep area. So I'm going to take you back with me. And this is where we bring the patients to first start their process before surgery. And I'd have them take a seat, and I would go over any medical history or any pertinent information that we need to know prior to surgery. And this is where I would also check their blood pressure and their vital signs, just to have a baseline prior to surgery. Then I'm going to take the patient and bring them into our marking room, which is held over here. And in here, you can come on in. This is where Dr. Tehrani actually marks the patient and gets them ready for surgery. So I would have them change into a nice gown, and then Dr. Tehrani would have the patient marked in here, and they leave all their belongings in this room. Then from there, I take them into the operating room. So the majority of patients are very, very anxious prior to surgery, and that's completely normal. They also feel very vulnerable, so it's my job and my passion that I love to pretty much hold the patient's hand through the entire process, answer any questions they have, any concerns that themselves or their family members have prior to surgery. So I'm going to take you into the operating room where we bring the patient, and I bring them in here. And this is our state-of-the-art Joint Commission accredited OR. And here we bring the patient onto the stretcher. We have Board-Certified Anesthesiologists who will all be, who would be over here. And this is where the anesthesiologist pretty much takes over, greets themselves, and will potentially start an IV and get their process going. And I sit there and I actually hold the patient's hand and make them feel comfortable, because this is where you walk in and you get even more anxious. So it's important to just be with the patient at all times. And this is Nikki. She is our Certified Scrub Technologist.
Hi, I'm Nikki. I currently work as a Certified Surgical Technologist who works exclusively with Dr. Tehrani. My job here is to prep the OR before surgery, assist Dr. Tehrani during surgery, and maintain proper cleaning and sterilization of the instruments by JCAHO Standards.
So once surgery is finished, this is where myself and the anesthesiologist would escort the patient outside into our recovery area, which is held over here. And bring the patient right over here. We make them very comfortable. We hook them up to monitors, just to monitor their blood pressure and everything after surgery. Patient usually recovers here depending on their surgery. Really depends on how long their recovery is. Once they feel okay, then we help them and we escort them over to our recovery area over here, where we sit them on the chair. We get them some water, some crackers, see how they're doing, and go over all their information after surgery that the family is also going to need to know. So we usually tend to go over that with both patient and family. And we answer any questions and concerns, and as soon as you're feeling good to go, then we send them on their way.